on the Eastern Cape's health systems as the province records a spike in COVID-19 cases. Experts say the province's embattled healthcare system is being stretched to capacity with the increasing demand for high care and ICU beds. The increased workload in the hospitals is being exacerbated by the 850 healthcare workers who've been infected. Just yesterday, doctors, nurses and cleaning staff and porters downed tools at Port Elizabeth Dora Nginza Hospital. The Eastern Cape Coronavirus Command Council will now update on the efforts in the fight against the virus. Let's go there live.
Hospitals to address challenges faced by other health workers at the Dora Nginza, Livingston and other hospitals in our province. The problem of oxygen availability is a national problem of demand and supply. In the Eastern Cape, we have oxygen available in all our major hospitals. The problem of maternity overload was caused by the maternity and obstetrics unit from the feeder clinics, which were affected by staff who had COVID-19 positive infections. I think in this case, I must also appreciate the support, the intervention from the other countries who are really pledging solidarity in this fight to serve humanity. We have donations that we've been receiving. We have latest donations of about 10 ventilators that are from USAID. On the work that they are doing, that they've been doing with our province, I've got a report that those ventilators have arrived this morning in PE. They will be distributed across the province to assist us beef up our capacity to make these ventilators available to the geospread of our province. Our department will provide additional nurses and general staff for UTNA and the Motherwell maternity services. The provincial department is acutely aware of the impact of staff who test positive, and in response to this challenge, the Department of Health has published an advert aimed at recruiting doctors and nurses. We have set up systems in place, all the mechanisms, the occupational health and safety committees working with the labor to ensure that we've got a swift turnaround on cases like this. These standard operating procedures are in place. We've formed joint monitoring teams. We meet with the labor on a weekly basis. That team is led by the MEC herself. So we are in constant contact with the critical stakeholders on this to ensure that we do everything possible to support each other, but also to protect workers, especially the frontline workers, who are very much critical for the work we are doing. All of us must work together to protect our health system from collapsing. This we must do so that the health system is capable of providing quality health care to the people of our province. We must prevent the infections by adhering to the regulations of the national lockdown. We have now opened first phase of the first field hospital in our province, the Reverend Dr. Mamisa Chapulanyeweni Field Hospital, which will give us 1,400 beds soon and 3,300 beds when completed. To ensure that we are prepared for the surge of patients with COVID-19 infections, we are in the process of building one field hospital in Pierre District and the metropolitan areas of our province with 500 beds per field hospital. This will give us a combined total of 4,000 medical beds throughout the province. These are not normal beds. These are medical beds with all required medical equipment to save lives. We have recruited additional 1,000 nurses and over and over 5,000 community health workers in the province. We remain focused on investing in the sustainable solution, such as health services, facilities, and sustainable infrastructure in our fight against this pandemic. We have awarded 42 contracts worth 222.8 million to Eastern Cape-based contractors for refurbishment of 34 health facilities across the province for COVID-19. These projects are currently at various stages of implementation, with 20 projects having already been completed. 12 projects planned to be completed by the end of July 2020. The completion of the remaining 10 projects earmarked for the end of August 2020. Approximately 500 work opportunities have been created thus far, and this number will increase as more work is being done. We've developed the Provincial Economic Recovery Plan, which is aimed at saving the provincial economy from the hardship caused by COVID-19. You'll all understand that in our work of saving lives, we must balance that with the preservation of livelihood. Part of this plan is for us to inject money into priority sectors of our provincial economy, such as tourism, construction, manufacturing, agriculture, and agro-processing. Our current program is to increase the total supply and demand of goods and services in the provincial economy, increase employment levels through labor market absorption of critical occupation and demographic segments through the skilling and upskilling, drive reindustrialization through provincial catalytic projects and rural non-farm initiatives based on unique strength and potential of the province. Build equitable and inclusive economy through SMEs, township economies, informal sector, and social economy. We are also mobilizing public investment and create sovereign wealth funds to boost public fiscus. To date, the provincial government has injected 11.1 million into the privately owned establishments in the tourism sector that we are using as quarantine and isolation facilities. We are doing this to support small enterprise and encouraging big establishments to protect jobs and the whole value chain in the tourism sector. There are 5,140 normal unemployment insurance fund payments received and paid to beneficiaries in the province of the Eastern Cape between 22nd and 26th June 2020. And the monetary value of this is 19.9 million. As of the 27th of June 2020, UIF paid out a total of 1.4 billion of COVID-19 temporal employer-employee relief scheme to companies in the Eastern Cape, which benefited 32,617 employers and 336,268 employees in our province. The Department of Small Business Development has approved 55.3 million of its COVID-19 SMME debt relief fund, benefiting 155 SMMEs, protecting about 1,951 jobs. Approved 241, 500 of its father shop support program, benefiting 69 SMME, protecting 130 jobs in our province. Our provincial government assisted these small businesses to apply for these funds. The compensation fund received 100 COVID-19 cases as reported by employers, and so far 88 were registered and adjudicated, while 12 cases are not yet registered. The outcome of the adjudication is as follows. In 52 cases, liability was accepted, while in 3 cases, liability was rejected. These are 33 COVID-19 cases where more information was requested. Employees are encouraged to report COVID-19 cases contracted at work. We appeal to the Minister of Transport and the airport company, South Africa, to ensure that East London Airport is open when the other airports are opened, so that people traveling to the province through East London Airport are not inconvenienced. We have international investors here that have been complaining. We've got big business here that has been complaining. Unfortunately, Eastern Cape is also linked to the national economic hub. And East London Airport serves the greater population of our province. It's a very convenient airport to serve even the eastern part of our province. During this time, when development of cluster outbreaks is showing to be a problem in our province, we want to make a special appeal to Santaco members to adhere to the lockdown regulations, offloading 70% of passengers and use of permit for traveling. If this is not done, taxis will become places where people will be infecting each other, because loading 100% of your passengers does not adhere to social distancing. Taxi owners are also susceptible to infections. The lockdown regulations are protecting them, their passengers, as well as the communities. On behalf of out of total 5,125 schools scheduled to be open in the province for the first phase of reopening, only 3 were not yet opened because they were awaiting delivery of clean water to fill up their recently delivered water tanks. To date, 291 schools have been affected by COVID-19. 200 of these schools remain closed, while 91 schools have since reopened. To contain and mitigate the spread of infection in our schools, the Provincial Department of Education conducted COVID-19 orientation schools training for 44,776 teachers and 5,040 principals of 5,064 schools. The department sent out questionnaire to be filled by schools for the second phase of reopening of the schools, and 3,085 out of 5,135 schools responded, indicating that they are not ready for the reopening of grades planned to go back to school on the 6th of July 2020. The Provincial Coronavirus Command Council has resolved to engage national government to grant the province extension of 2 weeks to prepare for all schools to be adequately ready to reopen in a manner that meets COVID-19 protocols. The Provincial Department of Education has transferred 165 million to schools for National School Nutrition Program. Today we are delivering 8 Mercedes-Benz Sprinter buses certified to carry 23 people to special schools of our province to transport our learners with special needs. These buses were converted to suit the needs of the learners. The Provincial Department of Education provides buses on a 5-year rotation to special schools which are suitable to their specific needs. Learner transport remains a pressure as learners in special schools in the province are transported over vast distances. These buses, which are parked outside this venue, will be delivered to the following schools: King Lovier's Special School, Or Tambo Mount Fletcher Special School, Joe Gabi, Star Special School, Or Tambo, Vukuhambe Special School at Buffalo City, Amasango Special School at Alwal North, Amasango, Grahamstown in Sarabatman, Lingom Soleto Special School for learners with severe intellectual disability in Amacholi East, St. Thomas Special School for learners who are deaf in Buffalo City Metro. Thank you. It saddens me, colleagues, that in this period we have 375 cases of rape that are being investigated by the South African Police Services in our province. We reiterate the call for all of our people in this province to join hands in the fight against the scourge of gender-based violence and femicide. As government, we will continue to improve our response to gender-based violence and femicide by ensuring that perpetrators are brought to book whilst taking good care of survivors. All of us must protect our girl children, sisters, aunts, and mothers from abuse by reporting any incident of abuse to law enforcement. Let us encourage women to report abuse. In that process, we must stand with them, support them through this process. As I conclude, Program Director, the relaxation of regulation does not mean we have won the war against this virus. But government had to do this balancing act to ensure that we do not get into an economic calamity of extreme proportions that we would never recover from. Every citizen has a responsibility to protect himself or herself from this virus. We do not know when it will end yet, but we are certain that a vaccine will be found as health scientists are working hard to find the vaccine. For now, let us remain optimistic that we will pass this dark phase of our lives. In the beginning of the outbreak in our province, funerals gave us high numbers of infections in our province. We appreciate the ongoing compliance by people of our province with the limited numbers of people attending funerals. We also make a special plea to the people in this province not to congest in towns. We defeated this for the payment of social grants. If we can do it during the payment of these grants, surely we can do it daily. Siyabongoza sicela kubantu bakuthi ukuba siyeke ukugcwala ezidolophini. Kuba xa sigcwele kwezi ndawo maninzi amathuba okosulelana ngale ntsholongwane. Sikwazile ukuyinqanda le nto ngeemini zenkamnkam, kwaye nangoku singakwazi. Le ntsholongwane ihamba nokuhamba komntu. Xa abantu bengahambi, le ntsholongwane iyabhideka. Siyabacela abantu bakuthi bahlale ezindlini. Uphume kuba kunyanzelekile, kuba phuma. Kuba ingxaki yakho yokuphuma endlini ubheke edolophini, ii-chances zokokuba ngoku ungabuya unevirus zinkulu kuba sisondele kuvuthondaba lale virus. We appeal to all our people of our province to continue adhere to social distancing in the fight against COVID-19. Every one of us must abide by the regulations that have been published by government and must take this virus very serious. While these are trying and troubling times for our province and our people, each and every one of us has a responsibility to play our part by protecting ourselves, those we love, and our communities. Lamazwi ke angafana kwangathi ngamazwi aqhelekileyo kuba kudala siwathetha konomathotholo nasezi-TV, sicela abantu bakuthi sibabongoza okokuba bathobele imigaqo, bahloniphe imigaqo eyenzelwe ukukhusela ubomi babo. Siyabacela ngabantu bakuthi bayenze loo nto ngokuthi rhoqo bahlambe izandla zabo ngamanzi anesephu okanye basanitize rhoqo, bahlale ezindlini, baphume xa kunyanzelekile, bagcine umgama phakathi kwakhe umntu nomnye umntu ngamaxesha onke. Bantu bakuthi ngoku sifika kwixesha elinzima apho sisondele kwinkcothoyi okanye kuvuthondaba lwale ntsholongwane. Eli lixesha apho amanani okosuleleka kwabantu azokwanda khona, apho abanye kungenzeka basishiye kulo mhlaba. Oku singakunqanda ngokunciphisa ukosulelana nokosuleleka nokusasazeka kwale ntsholongwane. Siyabacela abantu bakuthi sifikelele kwixesha lokuba apho umntu wonke ethatha uxanduva ngobomi bakhe, ethatha uxanduva ngokukhusela ifamily yakhe, ethatha uxanduva ngokukhusela i-community yakhe khona ukuze ilizwe laseMzantsi Afrika likwazi ukubheka phambili. Sihalela uba le ntsholongwane siyibone igqithile, kodwa uba ngaba asiyithobeli le migaqo nale mithetho imiselweyo, sakuhlala nale ntsholongwane ixesha elide kuba abantu abaninzi bakuqhubeka besosuleleka. Sele siscreene abantu abaqabeleyo ku-2.5 million kule province. Sizama ukukhangelana nale ntsholongwane. Siyaleqeka emveni kwabantu, sizama ukutracer kangangoko, and sizama ukuqinisekisa uba zonke i-significant contacts ziyafumaneka. Kukhona ke apho kusafuneka siqinise khona ngakumbi, apho sizama ukubongoza abantu bakuthi bayeke ukubukula abo bathe bafumaniseka benale ntsholongwane, kuba isenzela umsebenzi nzima ngokuba abantu bazifihle, bangafuni ukuziveza, bazigcine ngelo xesha bayenzakalise abanye abantu bengaqondi. Siyabacela ke abantu bakuthi ukuba lento yestigma masahlukane nayo. Umuntu othe wazibona eselishweni lofumana le ntsholongwane makanikwe inkxaso, anikwe support njengoko oogqirha namanesi bezama kangangoko. Ngoku wonke umuntu uyachaphazeleka. Iifemeli zethu sonke sinemingcwabo, sonke sineengxaki zokokuba sisahlukana namalungu eefemeli zethu. Siyabacela sibabongoza abantu base-Eastern Cape into yokokuba sikwimeko embi, and uba ngaba sizawukwazi ukusebenza sonke sithobele imithetho nezibhedlele zethu zawukwazi ukumelana neengxaki ezijongene nazo. Kodwa xa ngaba la manani akhula ngolu hlobo akhula ngalo, azuzukwazi izibhedlele esinazo zase-Eastern Cape ukumelana nale meko. Sasitshilo kwangaphambili into yokokuba yenye yemingeni esinayo umgangatho wezempilo kumasebe okanye kwizibhedlele zethu. Ngaxeshanye le coronavirus isibonise okokuba sisenoxanduva olukhulu lokuqinisa indlela urhulumente asebenza ngayo. Zikhona ezinye izinto ebefaba ziyenzeka lula xa kuthe kwachaphazeleka apho okokuba kuzodicontaminathwa. Siyabacela abaphathi bezibhedlele njengabaphathi bezikolo sibonakalise ubunkokheli kwezi ndawo zinjengezi. Sikhawulezise, ayifuni mphathiswa into yokudecontaminathwa nokuklinwa kwesibhedlele xa kuthe kwatesta umntu positive. Ifuna i-leadership kula level ngokukhawuleza okukhulu, kungadanga kwabakho ezi ngxaki sizibonayo nabasebenzi beqhankqalazela izinto ezifanelekileyo. Umntu oyi-significant contact yala patient index patient fanele lo mntu alandelelwe, atestwe ngokukhawuleza. Sizama ke ukwenza loo nto, kodwa siyayibulela itimu yethu lena itesta abantu, benza umsebenzi omkhulu kakhulu. Nalena itrisa abantu zithe sayo yonke indawo apha eprovinsini, zilandelela umkhondo kwaye nabani na. Singangafiki ke ngokukhawuleza kuye wonke umntu, kodwa enze report kuba abanye abantu abazivezi, singazazi neecontact zabo kakuhle kuba besoyikwa ubukulwa njalo njalo. Funeka sibambisane ke siyilwe le nto yokubangela umdinzi netyheneba kubantu bakuthi abadibana le ntsholongwane. Sicela abantu bephondo, sicela iinkosi, sicela abefundisi, sicela wonke umntu osomashishini, sonke siphose kwisivivane sokukhusela nokuhlangula ubomi babantu bakuthi. Kodwa abantu bakuthi mabathathe uxanduva ngobomi babo. Uba uhlala endlini awuphumi, akuzubakho sizathu. Nale nto siyixoxayo yo-100% beeteksi izawuba yinto yabasebenzi. Abantu abaninzi akho mfuneko baxoxa loo nto, xa uhlele endlini uzikhusela kwintsholongwane awuzuchaphazeleka ngokokuba ube kuthethwa ngawe ngendlela sithetha ngazo ngoku. Siyabacela ke abantu bakuthi sibabongoza, sizithoba kubo, urhulumente ngowabo, mabasebenzisane norhulumente, banike inkxaso kurhulumente, abakwazi ukuphakama bancedise benze igalelo labo. Yiyo le nto sithe sifuna ukusebenza phaa kweza ward-based war rooms, apho sizawukwazi ukuncedisana sinike i-support efanelekileyo. Ngoku wonke umntu uyayinida i-psychosocial support. Sikuloo meko everyone nathi thina zinkokheli, where we are, we get traumatized by cases esibhilishana nazo every day that we are trying to solve, that we are solving, but i-challenge inkulu lo mcimbi we-COVID-19 ayingomcimbi nje wase-Eastern Cape okanye eSouth Africa, ngumcimbi wehlabathi. Siwubonile ukugqogqisa kwawo ehlabathini nokuhlukumeza abantu behlabathi. So sikwixesha ke ngoku lokuba nathi siyifunde, siyibone loo nto, sisondelelane, sibambisane, sizinikezele kulo msebenzi, sisebenzisane. Nathi sizinkokeli siyachaphazeleka, siyosuleleka kuba nathi singabantu, siye sizinikezele okokuba sibe ngaphambili sisebenze noogqirha namanesi ukunceda abantu bakuthi. Enkosi kakhulu.
I think we're battling with Microsoft Teams there. There's a long list of complaints from other journalists who could not be here. But we will try and make something. I'm going to request MECs to make
Coming out of that presentation by the Premier of the Eastern Cape, Oscar Mabuyane, on the latest efforts by the province again in the fight against COVID-19. You're watching The Agenda. Let's take a break.